The title of the project is Improving the Quality of Intravenous Procedure for Pediatric Patient Coming to Pediatric High Dependency Unit at RPC AIIMS, New Delhi. Intravenous procedure is one of the most commonly performed procedure in hospitalized patients where IV access remains susceptible to infections and non-infectious complications. However, less attention has been paid to the system required for the quality care. Aim of the study is to improve the quality of intravenous procedure to pediatric patient coming to pediatric high dependency unit RPC from baseline 25% to 60% over 8 weeks. Methodology: we use improvement science method in improving the compliance to intravenous procedure practices. So following steps were followed in the project: QI team form, problem analysis done, data collected using measurable tools, change idea tested through BDSA cycle. Baseline data: this is a line chart where x-axis is the days and y-axis is the numerator interested, and dot shows the level of performance. Baseline data was collected from 6 March to 20 March 2019, where the baseline was found to be 25%. In problem analysis, we use fishbone to analyze the problems. During the problem analysis, poor standard of IV procedure was found due to many factors like place issues where there is no designated place for IV procedures and there is no hand hygiene facility at the point of procedures. Policy issues like there is no SOP for IV procedure, there is no fixed timing for blood sampling, and in procedures like required articles for IV procedures were not available at the point of procedures, no biomedical waste management at the point of procedures, and there is no designated staff for the IV procedure. So after finding all these issues, we come to testing change idea 1, that is designated trolley for IV procedure. In plan, we plan to arrange designated trolley with all required articles for IV procedures, PMW pin, needle destroyer and sharp container to make available at the site of procedure. In 2, designated trolley placed near PHDU with all articles required, PMW pin, needle destroyer and sharp container were made available at the site of procedure with the help of sister in charge and the assistant nursing superintendent. In study, data collection and analysis was done, and in ACT adopted the change idea. Testing change idea 2, that is fixed timing and designated staff during the procedure. In plan, timing of the procedure and availability of staff were discussed with ANS and the faculty. In 2, fixed timing for the procedure where circular were distributed to all the wards, designated staff for 1 hour during the fixed timing for the procedure, that is 10 to 11 a.m. In study, data collection and analysis done, and in ACT adopted the change idea. Coming to data collection, data were collected using checklists. Measuring quality of care is through outcome measure, where numerator is the number of score, that is yes in the checklist, divided by denominator, that is the total number of items in the checklist. Checklist includes domains related to infection control, availability of staffs and articles, biomedical waste management, availability of space, and time taken during the procedure. Coming to the result, this is the result where we find significant improvement after the BDA cycle 1 and 2 as compared to the baseline data. The first BDSA was done at 23rd March and the second BDSA was done at 31st March. So after this 2 BDSA done, significant improvement were seen in the graph. So to conclude, simple rearrangement of supplies can lead to significant improvement in quality of IV procedure from baseline of 25%, which increased to 79% after the intervention. So to bring improvement of such procedure, a collaborative involvement of all the healthcare team is important. Thank you. Close.